Today's topic is on mental health, and as appropriate and perfect timing, we have our Cleveland Clinic psychiatrist with us today, Dr. Ajmal Razmy. It's Mental Health Week, so we will have we're very honored to have Dr. Razmy with us today. Before I introduce Dr. Razmy, I just wanted to point out that with this global pandemic, there's a whole new set of stressors. We're worried about our health. We're worried about our family. We're worried about our extended family. We're worried about our finances. We're worried about all the new caring responsibilities. We're the teacher and the parent and the spouse. And there's lots of people out there with loneliness and anxiety for sure related to this. Recent polling, in fact, has shown that 50% of Canadians are feeling that their mental well-being has gotten a lot worse. So we'll talk about that today as well. But before we do anything else, I wanted to introduce Dr. Ajmal Razmy. Dr. Razmy is our psychiatrist at Cleveland Clinic Canada. He's also chair of the department at Joseph Brant Hospital. He studied neurosciences at University of Toronto and also psychiatry at University of Toronto. He has special interest in sleep disorders and is published widely on that, but he also commonly treats mood disorders and anxiety, which are even more prominent right now during COVID. So first, I wanted to welcome you, Dr. Razmy, and thank you for being here today. I know you have about 4 other talks that you're giving today, and but I first wanted to see how you're doing and how you're coping with everything.
Thanks, Dr. Campbell. It's an absolute pleasure to be on this call today, and thank you to all of those who can join. I'm really pleased to be able to even speak about this issue, given the fact that it is, as you mentioned, Mental Health Awareness Week. And I think every week should be Mental Health Awareness Week, but that's, if you ask every specialist, they're going to think that their specialty should be the specialty of the week. But during this unprecedented time, I think it's such a unique opportunity to be able to share some good messaging to people. Now, your question was, how am I doing? Well, I have to be quite transparent. I'm doing terribly. I feel like I'm at my wit's end with what's happening. I'm a psychiatrist, as you mentioned. I'm busy with my clinical work, but my day usually starts off at 7 a.m. with my 4-year-old kicking me in the head, reminding me that it's time to get up. I roll out of bed. I have another 8-month-old that's not too far away, knowing that I've already been kicked and I'm up now. And then I have my 7-year-old son as well, scrambling throughout the house. And I know that our CEO, for example, has 5 little ones running around as well, although they're a little bit older. But that's how my day starts. It starts with some children calisthenics, if you will, trying to get a grasp on what the day holds in front of me. But there's been a process here, right? So I think the initial response to what was happening with regards to this novel coronavirus and the panic-demic that it's kind of ensued has forced us to adapt. And I think that's the beautiful thing about our species, is that we've always adapted. And I really want to send a message out to the viewership today that it's okay to not be okay, because I'll be honest, I'm not okay half the time with the amount of stress and adjustment I've had to make. But there has been a lot of silver lining. There have been opportunities to share with my neighbors, with my community, with my colleagues in ways that I've never done before. So I'm struggling day to day like most people are, but I am finding resilience through understanding, through adjusting my schedule on a daily basis, and through making time for the things that really matter the most. And it's ironic that these times really highlight what those things are for us.
It's interesting. I was talking to Dr. Razmy last night on the phone while he was bouncing his 8-month-old on his lap. So I could tell that there was a lot going on in your life for sure. So thank you again for being here. That's great. Now, and good luck with your journey through this for sure. Now, we had talked earlier about Canadians and how 50% are feeling that their mental health has not been favorable. And how are Canadians holding up? You had sent this great slide, and I'll let you address it and explain it.
Sure. So this was an Angus Reid poll that came out probably around 10 days ago. That was on the CBC website. And basically, half of Canadians say that their mental health has gotten worse. Job losses and social isolation have decimated people's mental health. This graph shows 44% of individuals state they're worried, close to that, anxious, and even depressed. But I think it's important to highlight there is optimism as well there as that's mentioned. So we are showing some of that resiliency that I mentioned. It's important to note that we are struggling, but it's not unique to Canada. Even recent polls in Australia, for example, have shown a 30% uptick in terms of depressive and anxious symptoms. Some of the early data out of Wuhan has also shown that healthcare workers in particular were victims of significant distress that was quite debilitating as well. And that's data from January of this year. So we're not alone. Canadians are not alone in terms of how their mental health has unfortunately unfolded since this novel pandemic. But we have to do things about it. And I think that there's two issues here that I can identify. Number one, there is a wave of mental health distress that's kind of come through with COVID-19, sort of new onset. But then there's also a whole tidal wave of individuals that were already suffering from significant mental illness, and you take away people's jobs, you isolate people, and inevitably those are the ingredients to even worsen their already fragile mental health state. So I guess the questions that I hope people are asking is, what do we do? Do we engage in more outreach? Do we keep the focus on socioeconomic policies to help the social determinants of mental health? Or are there other evidence-based strategies that we can employ to help the mental health of our nation?
And certainly we'll get to some of those today, hopefully, in our discussions. I know that you talk a lot about mental health, and what are some of the impacts, you know, short-term, long-term, and so forth.
So what's really interesting about the novel coronavirus to me is the way the shadow of mental health follows the actual infection and viral rate of COVID-19. And the immediate response has been felt at different stages throughout our country, throughout Canada and the world. But I want to really harp that it's okay not to be okay. And in fact, the majority of people actually will get through this relatively unscathed and maybe even better for it. However, the immediate concerning symptoms that people have expressed are things like fear, distress, anxiety. Many of my patients have relayed to me that this has been a very traumatic experience and has already decimated their already bleak kind of outlook on the world. And some individuals have even told me, you know what, doc? I don't want to say this, but it's kind of given an opportunity for other people to know what it's like to be depressed and anxious, what it's like for your world to turn on its head and for you not to have the things that you took for granted potentially, or you thought were owed to you. So that's an interesting take on it as well. But the immediate response, I think there's a lot of fear, a lot of anxiety. As we move forward in time with the coronavirus, I think we're going to see more and more burnout. Certainly some of my colleagues are already experiencing that, fatigue, grief reactions, have to be mindful about substance misuse. In particular, if you look at lineups at your local liquor stores, depending on the province you're in, it's not just the social distancing that's adding to that lineup. There is a huge uptake in terms of substance use. Some people say twofold increased use of alcohol, for example. And the enduring impacts of COVID-19, I think, are going to be what is going to be a significant uptick in terms of actual mental illness. Now, remember, the difference between mental health and mental illness is mental illness is an actual disorder, and there is socio-occupational impairment. And unfortunately, as we saw post 9/11, there's going to be a great uptick in terms of mental illness and as well as substance use disorder.
Certainly you mentioned about alcohol. I know in family practice, we've seen a lot of problems with alcohol. A lot of people that have been alcoholics and have been sober, this has kind of restarted that process, and we'll address that a little bit later too, perhaps, because I think we have a couple of questions on that. And by the way, anyone that has a question, please go to the chat box and send it in, and we will get to it today. The other thing that I've heard you talk about, Ajmal, is the fight or flight response, and how that relates to this COVID time. In particular, the pushing that panic, how do you not push that panic button or the catastrophic thinking button, which is kind of part of that fight or flight response?
Yes, I mean, if you want me to just, maybe it's good to take a little step back. Not everyone may understand what the fight or flight response is. We can all talk about it, but basically it's a physiological adaptive response. So like you see a bear, you better run. And so some of the responses, like there's physiological responses like dilated pupils, or you feel shaky or trembly. You might have flushed skin, and you might feel like you're tachycardic, or your heart's starting to beat really fast, your breathing rate increases. These are like biologically adaptive. This is a biologically adaptive mechanism that has helped us survive. You see a bear, you should probably run or walk away briskly. And so with the novel coronavirus, this is an invariably unpredictable super agent that is like has a perfect recipe to cause a siege of the flight or flight response. And that's what's really kicked in for people. Remember, our brains are wired to favor predictability. We don't like dissonance. And when there is dissonance, that's when the emotional brain, or a reptilian kind of emotional limbic system, gets kicked into overdrive. And then our evolution of our prefrontal cortex and our rational mind to be able to tone that emotional brain down starts losing. And because of that, acute stress can become chronic. And what we get is we get sleep difficulties, we get changes in personality or irritability. And unfortunately, this can even go forth with depressive or anxiety type symptoms.
So looking at some practical things along coping, I know in family practice, we address some of these as well. I'm not a psychiatrist, but I do nag at people about exercise, for instance. I am an exercise physiologist and sport physician. So, I've been really pushing 30 minutes a day minimum of doing some kind of activity, whether it's running outside and keeping your distance from people, to walking or what have you. It's tough with the gyms and everything being closed, of course, right now, but also is eating properly and eating well. And we've had a number of speakers, from exercise physiologists to the dietitian to the psychologist, who have talked about routines and how important that is in this coping process and being at home. Perhaps you could address some other things. You already mentioned about alcohol, and it says drink sensibly on this little poster, but what are some other things we can do to help cope through this time?
Yes, great comments there, Dr. Campbell, and certainly the basic ingredients, eating well, hydration, exercise. For sure, that's like wellness 101, but we all are, guilty of not following through with that, myself included. But I think it's important to understand that we need to book into our schedules an opportunity for healthy breaks. What I advise some of my patients is a take 5 approach, meaning take 5 minutes out of every hour of your activity during your day, or work day, if you will, for yourself. Whether that means engaging in activities like mindfulness, whether it means doing a little bit of an internal scan of what's happening in terms of your emotions, in terms of your behavior, in terms of your thinking, or an external scan, what's happening around you. Have you actually noticed that the leaves are coming out a little bit, that we have birds chirping in the morning, that there's a little more activity, a little more optimism in the air? To do those internal and external scans, I think, are important. Taking time to jot down our thoughts, to distance ourselves from our negative emotions in particular, I think is important. And all of these activities, there's a whole list, I could go through dozens, I think ultimately serve the purpose of psychological distancing. So we talked about social distancing. Quickly, people said, hey, no, we just want physical distancing, not social, which is right. Good. But I think the concept of psychological distancing is important. I'm not implying that we need to move away from each other, but it's more within ourselves. If we can separate whatever we're going through from a distress perspective from our own identity, that's going to allow us to have greater control and mastery of it, again, using the rational mind over the emotional mind approach. So by doing these activities like logging or journaling your feelings, by using language, we will all get through this together. It helps to distance the actual situation from your identity. And the more you can do that and engaging in these lovely things that you're talking about here in this graphic, it'll allow you to enable your prefrontal cortex to drive you home.
Yeah. Great, great ideas, and very important. I like the idea about taking 5 minutes from each hour just to push away and to do something for yourself or loved one, for sure. You have talked about some of the coping strategies, but I've also heard you talk about psychological first aid, and I wondered if you could address some of these issues that I have before you here, and in particular the first aid, because that's slightly a different concept that some people have not heard about.
Yes, absolutely. So I really like the British Psychological Society's approach to a stepped mental health response. And basically, if you think of the response, because one of the things is, okay, we're all a little bit, our nerves are in the air, right? So what does that mean? Do we all rush to see a psychologist or a psychiatrist or any mental health professional for that regard? Is that appropriate match needed? Are we actually meeting people where they're at in terms of their distress? And I think psychological first aid is important in that it fits into the pyramid of response. I think the base of that pyramid in terms of a stepped mental health response is addressing the social determinants of mental distress. So our government stepping in and making sure that people hopefully have financial support, and also making sure that we have access to groceries and other essential services. That's the base of the mental health response. As we get into the core of it, psychological first aid, which is really about empowering at a community-wide level the ability to engage in cognitive behavioral approaches, for example, getting in tune with your affect or your emotional side, as well as your behavior and your cognition, understanding how that all interplays to give you almost a do-it-yourself, a DIY approach to wellness, an approach to resiliency, an approach to sustainability of your mental health function, so you don't escalate to the top of the pyramid, which is when you need that mental health intervention by our lovely colleagues in mental health. So that's why it's important to really, I think, frame the coping strategies in that stepwise fashion, because then you can meet individuals where they're at in terms of their requirement for support. By and large, we can all do with a little bit of knowledge in terms of cognitive behavioral strategies, for example, because that's one of the developmental stages of understanding your mind and your body and understanding how to cope during these difficult times.
Now, you also talk about mindfulness, and you've mentioned it, and perhaps you could take a minute and talk to us about this, because it seems to be so important for all of us during this time. I know we have a little bit of time here today, so if you wanted to take a minute and do an exercise, you could certainly do that as well, and we could engage the audience to take part as well.
Sure, I mean, absolutely. So what does it mean to be mindful, right? I mean, it's a $5 term that means so many different things to different people, but mindfulness really has to do with a general awareness and acceptance of the here and now. So if people are on right now, I encourage you to kind of shake out whatever you're feeling at this moment. Close your eyes if you feel comfortable, you don't have to. Take a deep breath in and let some of that distress out. Another big breath in.
I feel better already.
And out again. And I want you to sit with your thoughts for the next 20 seconds and think of something that you're very grateful for. What do you give to gratitude? What do you give gratitude to in this moment? Just take 20 seconds. And come back. Now, I'm not a mindfulness guru. My chief of psychiatry, Dr. Steve Selchin, is an incredible mindfulness expert, and I by no means claim that that this is my forte into things. But I do acknowledge that, and I must be open. I for the longest time did neglect the power of mindfulness. Although I used it sparingly, but more and more since COVID-19, I'm certainly engaging in it. I'm actually taking a mindfulness course right now to help me understand. And again, mindfulness, it's not easy for a lot of us, Dr. Campbell, I'm sure for yourself as well, and that are go-getters here at Cleveland Clinic or other places, to tune out, to be able to settle with their own mind. I noticed, you know, even a couple of breaths in, you already made a comment, right? And it's just like, that's telling me, like, is she able to kind of decompress there, or did she want to just make a comment right away? So all of these things are going on. For me, the power of mindfulness is to free up your thoughts, present and past, to accept the present moment, to get in touch with your senses, and to do, for me, like at a basic level, an internal and external scan. So if you are better prepared for this moment, that gives you an opportunity to be better prepared for the moments that ensue, whether good, bad, or whatever.
So excellent. Thank you for taking us through that. How do we move forward with all of that we're going through right now? I've heard you talk about kindness, and perhaps you could give us your thoughts on where do we go from here?
Well, first of all, I want to make sure that people understand going forward doesn't mean going beyond COVID-19. There is also, I think by going forward, there is an element of acceptance. And I think that's going to our previous discussion about things like mindfulness, I think really help with the acceptance issue. So the more that we can understand that COVID-19 is here, it's here to stay for the relative future. And also taking, you know, zooming out and taking that 10,000 foot view again of understanding that over the last 20 years, we've had a number of different pandemics, whether it's SARS, whether we're looking at H1N1, Zika, and now the novel coronavirus. There is a lot going on in our world, whether it's issues related to climate change, whether it's issues related to migration patterns or globalization or urbanization. Our world is not the same, and the rates of these pandemics appears to be escalating. And so when COVID-19 goes, there may be something else. And so my point there is to move forward, there is an element of acceptance that this may be a new way of life. And there are many points to that. Number one, I think you need to really tap into being your own therapist. So again, having that psychological distancing to allow you to move away from identifying as whatever anxiety you may have as being you, scheduling mindful breaks and routines, checking in on colleagues and loved ones, having accountability partners. At times of war, they called it battle buddies, where you check in on your battle buddy to make sure they're doing okay. So I think these are elements to help us step forward. But if we really want to move forward, we have to understand that this is not a sprint and it's not a marathon. And in fact, it's more like interval training, which you would know more about than me, obviously. But there are moments, there are moments where we need to sprint, and there's other times when this is going to be a bit of a long haul because it's going to be around, not just corona, the novel coronavirus, but our way of life. It's important to put on your oxygen mask first, because if you can't do that internal and external scan of yourself, how can you possibly help your loved ones, your community, and the greater good of the population? So I think it's important to really harp on that point in terms of putting on your own oxygen mask. And lastly, the kindness piece, I think, is the silver lining in all of the situations related to COVID-19. Now, I acknowledge there are people out there who have had significant loss, who've had grief, who've had tremendous anxiety, crippling anxiety. And as we move forward to ramping down and out, there are a lot of people who are in their workplace wondering, I don't know if I feel comfortable going back to work. And what about my children when they go back to school? Are they going to get infected? We don't have a vaccine yet. But the opportunities that I believe COVID-19 has provided us are the silver linings of the condition, which are, we have chances now through these check-ins and accountability partners, for example, what I mentioned, or through other means in terms of connecting with those around us, to display kindness in ways that will be received far beyond just the moment. And maybe also accentuate maybe our previous patterns when we used to go to work and maybe not acknowledge the reception up front, or maybe not acknowledge the Tim Hortons worker in the lobby, and make you really appreciate that in a different manner. And in fact, lead to building relationships and understandings through this very difficult time that will take us all, I hope, to a new place. And I think kindness is the engine for that.
Well, those are great points. And I know for myself, it seems that this time really is an opportunity. COVID's provided an opportunity to grow in many different ways, as you mentioned, more caring for others, just even in our neighborhood, everyone is helping each other. We all go out at 7:30 and bang a pot, as many people around the world are doing. And it's a chance to show our best selves and learn about ourselves and what we're capable of. I have a number of questions here that have come in.
Sure.
And so we'll challenge you here a little bit. You mentioned increased
kindness is number one, right? So when you're asking your question.
Yes, I'll be very kind. So you mentioned increased alcohol consumption at this time. I think we both did. And someone is asking, is disordered eating also increasing? And my understanding was that it was, but I don't know if you have further information. It's certainly a control issue often.
Yeah. Well, it's a great question. I think when I talk about alcohol, and when you mentioned it as well, Dr. Campbell, this can be any coping and it's maladaptive coping. So for some people, in terms of eating is interesting. It's an interesting animal because we all know stress eaters and also stress like non-eaters, people that just drop weight precipitously when they're stressed. So it can go either way. Certainly, there's so many facets to that. So if we're looking in particular with some of the younger, usually women who suffer from eating disorders as well, this may also really challenge those type of eating patterns. But I think overall, maladaptive eating has been noted. People are talking about it with me in my clinics all the time. Usually it's increased eating, but I have seen the opposite as well. I think it has to go with how are we internalizing this process? How are we internalizing our distress? So if it's alcohol, are you drinking alcohol because you want to fall asleep at night? Because if you are, that's the absolute opposite approach in terms of your sleep architecture and the damage it can do in terms of your quality of sleep. Similarly, if you're having Cheetos every night while you're watching Netflix, which I have a couple times, I gotta admit, but if you're doing it all the time, then you have to ask yourself, why am I doing that? And so engaging in sort of cognitive behavioral light techniques, so the do-it-yourself kind of therapies, maybe you can do a little bit of a thought record around that, analyze the situation when you are engaging in increased eating behavior, if that's what it is, or restricted eating behavior, as it were. What are your emotions at that time? What are your surrounding environmental cues at that time? What is it saying to yourself about what you think about yourself, and really challenge those thoughts. And by breaking those behaviors down, that B in CBT, the behavior, that's what's going to target the maladaptive coping, whether it's eating, drinking, or whatever you're doing.
Someone has mentioned here that they haven't had sleep difficulties much in the past, but they've really been struggling a bit with sleep now, and wondered if you have any suggestions around that. I know that you're an expert in sleep.
Well, actually, if I am, I should probably get some myself. So first of all, again, to like many responses out there, I would say this is likely a normal response to a very significant stressor. But sleep hygiene 101, you want to make sure that you go to bed for sleep only. So don't bring your work and your laptop and everything else to bed with you. Try to use the bed for sleep, and maybe occasionally sex if you're doing it in a appropriate manner in terms of not having different partners come in and out, given the rate of infection that can go around. But I do think sleep hygiene 101 is important. Reducing the amount of alcohol, for example, that you take, especially late at night. Also, keeping active during the day so that there is some sort of homeostatic function in terms of wanting to sleep or having that drive to sleep. I would also, in this era of like routine being out the window for some people, I would also encourage not taking too many daytime naps because that can reduce the homeostatic drive to want to sleep at nighttime. And then beyond that, so, if things continue to progress, then, and if you're thinking about, oh, should I be taking like an over-the-counter sleeping medication, or, I really can't fall asleep and I'm not sleeping at all, there's significant insomnia, then I think you're getting to the point where you really need to reach out to your healthcare provider, consider possibly a sleep study to see if there's anything else going on. Sometimes the stressor itself unmasks another pathological process that maybe wouldn't have been unmasked. And so, the COVID-19 situation may just be fast forwarding that process for you. So basic sleep hygiene 101, if things continue to progress, I wouldn't hesitate in terms of talking to your health professional about potentially having a sleep study done.
And it also gives me an opportunity to plug exercise again, because a certain amount of exercise, moderate exercise, high intense exercise sometimes can even stimulate, and people have trouble with sleep at times. But generally speaking, being active during the day and being physically active and exercising will help the sleep as well. Another question here around sleep. They say, is it normal to require more sleep during the pandemic?
Again, I think both, so more sleep would be called hypersomnia, less sleep would be called insomnia. So there's going to be a perturbance one way or the other. I usually would use the blanket term, sorry to bring in blanket when we're talking about sleep, but the blanket term that I would use is, you know, it's okay not to be okay. And if there is some changes in your sleep patterns, it usually is reflective of this abnormal, significant stressor that we're all undergoing. The lack of schedule and routine also contributes to that. So if you find yourself you're oversleeping, I would try to think of what life was like before COVID-19 for you. So if you were the type of person, you woke up and you had your business attire on or whatever your work attire may be, and that kept you kind of normal, you had a certain schedule in place, maybe there's read the paper a certain time, whatever your regular routine was, I would try to adopt some of that into your life right now, because it may be that when that routine has been pulled, that carpet has been pulled from you, that you're like, okay, I'm just going to sleep all day. So that's one issue. But again, if things are abnormally hypersomnolent, like you're not at all waking up and tending to your chores or tending to your loved ones or your work, then that might be more problematic, and that's when you need to reach out to your healthcare professional.
Excellent. And it allows me to plug yet again the routine that everyone has brought up that has been on this webinar, from the exercise people to the psychologists. Yeah, they all stress the importance of routine in all aspects of our health, which is interesting. There's a number of other questions. One is about where can I learn more about the stepwise approach from the UK? And I'm not sure what stepwise approach they're referring to, if that's around alcohol, or perhaps you're familiar with this.
Yeah, so great question. I think I mentioned it when we're talking about the response to distress and meeting people where they're at in terms of their level of distress, not over prescribing psychotherapy or over prescribing medications, God forbid, and not missing the boat in terms of under appreciating the severity of what people are going through. So the STEP mental health response is from the British Psychological Society, and they actually have a COVID-19 staff well-being group. I really recommend it. It's like a 2-page read. If you Google that, you'll find it. If you're having any problems, I'm happy to provide that to the team here, and they can disseminate.
And what do they Google again, Dr. Razmy?
Google the British Psychological Society.
Okay.
And then if you want, you can put in COVID-19, and then they have some stepwise approaches. They're usually mostly for their actual society, but I think have very broad implications.
Now I have a very specific question here. I have a young woman says that she has a friend that has been sober for 5 years. I think it's a girlfriend, a female friend, and the female friend has started drinking again, and she's looking for advice to give this friend. Can you steer her in any direction, or give her some general principles of what she should be telling her friend?
Well, firstly, you know, that's great to see that you're looking out for a friend who is going through what many people are. I mean, the data out of China, by the way, shown that there's a double intake in terms of, there's a 2-fold increase in alcohol use, for example. And by the question's implication, being sober for a couple of years sounds like there may have been an issue previous to that. And so if you want to adhere to some of the principles that we talked about today, I think being that accountability partner, checking in to see where they're at, and expressing the fact that you have this concern about what may be maladaptive coping, like it is maladaptive coping, is step one. Ultimately, with most substance-related issues, the impetus has to come within the actual individual undergoing that. but you may serve as that guiding light, that reflective opportunity for them to see something that they may not be noticing. Many times, people don't actually notice they're actually going to the liquor store, a little more common, waiting in line when they probably wouldn't have waited in line, and now are opening up the cabinets a little more frequently. So I think very, very good of you to be that friend. This is an opportunity, another COVID silver lining opportunity, I think, to impart that kindness and hopefully share your concern.
That's
and
great.
It's really up to them to make the next stage.
Super. I think we have 2 minutes left, Dr. Razmy. And any final comments for people? Any final thoughts about this difficult time?
Well, I think I'll leave you with a thought that one of my, in addition to sort of talking with you today, I saw some patients and stuff and talked to them. And something that a patient shared with me today was quite impactful. And what they said was that they mean no malicious harm by this, but by the whole world experiencing this COVID-19 experience and having some of the mental health follow through social isolation or through financial loss, it kind of gave them a little bit of, people actually know what I go through. And maybe, although we can talk the talk and walk the walk, having had this experience with COVID-19 allows us to have an insight into what it must be like to have a chronic mental health related condition. Since this is Mental Health Awareness Week, give some thought and reflection about all of your stress and everything that you've been through, if you have been through that significant stress, and think of that multiplied in different sequences over time by our individuals that suffer from chronic mental illness. And think about how we can help support those people to help build a culture and community where not only is there mental health awareness, but we actually have programs that meet the needs of our individuals that are readily available, whether we use innovation and digital platforms or whatever it may be. But again, this opportunity through COVID is to see what it must be like to have the significant mental health distress and hopefully foster the kind of kindness we need to glue our community together.
Well, great advice today, and thank you so much for joining us. I believe that if people have any questions or want further contact, they can contact us via these means that I've put up on the screen. So thank you very much. Have a wonderful day. Good luck with the kids and your family, and thank you again.
Thanks for having me.
Great.